Hello, my name is Sean Park. I'm South Korean Urologist. We have a day of the Gay Men's Clinic Day. That's a mimic of the andrology practice in the Sir Ralph in the London, UK. I really didn't have a chance to ask them why they set a Gay Men's Clinic Day, but maybe it was too obvious. It's same everywhere. They ostracize someone who has a different, skin color or the taste or a different nationality, or it's just like a majority and minority thing everywhere. So for doctors, every man, whatever their sexual orientations or sexual, tendencies are, they are just a patient. And I believe it's one of our job to make them feel comfortable and reachable so that they can get the same services like the other people. There's no reason why we have to set distances or difficulties for them. But in reality, I've seen many difficulties for the gay people to get proper services. So I set a day at my practice so that they can have a more easier or the comfortable access to other doctors. So that my staff and or me, myself, doesn't unintentionally offend them emotionally or any kind of things. So we wanted to give a better service to them. The other thing what I have found is that in my country, in South Korea, gay men's community tends to think that not using a protection is showing some kind of trust or better in terms of relationship or something like that. But I'm not in a position to talk about it, whether it's a good or bad. It is not on my, there's essentially nothing good or bad, right? But still, in terms of the medicine, I want them to get a proper test and treatment when they had an unprotected exposure like that. Because if they are not, with a single partner, if they have a multiple partner, there's a higher chance that they might have infection. Also, good portion of the gay people are not just gay people, they are bisexuals as well. So you have to know that you need a test. So it's not that difficult to get a proper, testing. And to be honest with you, when I first got my urology board, I didn't know how to how to deal with the gay patients back then, because I have never seen a patient during my residency. And I was so ashamed of it. Even though I'm a urologist, I know not a single thing about it. So that's why I went to the, to get a better training in London, or keep asking my friends who has a better experience with the gay people than me. And also I had to find a textbook about talking about it, so explaining about it. So now I can say I know, and I can treat not as good as them, but I can say we have a standard gay men's practice I can provide now. So no worries, getting a treatment is a better way, and whether you will have a children or not, that doesn't really matter, because infertility is not just a thing, but what you can have is a very prostatitis or proctitis. It's just as nasty as you can think. So getting a better screening and the treatment is what I want to recommend to the my people in my region. So just get over it. You don't have to, be afraid of coming to the practice, because that's the reason why we had to set a day so that they can have unnecessary uncomfortedness when they come into the practice.